name's Danielle. I'm a student with Marian University, and today I'm going to be teaching you how to do proper PPE for a patient who has MRSA or C. diff. So when we are going to be taking care of a patient with MRSA or C. diff, the first thing we're going to do is we're going to be outside the room and we're going to be checking our orders. When we check our orders, we're going to see that our patient does have MRSA or C. diff and is in isolation. So then we're going to go ahead and gather all our supplies, which are going to be typically stationed outside the room in a cart. And then we are going to go ahead and get everything prepared before we go in the room. Before we start putting on our PPE, we want to make sure that we wash our hands with soap and water really well for C. diff, and you can do foam for MRSA. After you have washed everything, wash your hands, you're going to go ahead and the first thing you're going to do is you're going to put on your gown. So I have here a disposable gown, and what you're going to do is you're going to go ahead and open it up and put your arms in. Some people like to tie the gowns in the front. If you can tie it behind your neck, that is great. You can go ahead and do that. You want to make sure that you are not flailing the gown all over the hospital or anything, or getting it overly exposed to things it doesn't need to be, especially if we're going into a room with a compromised patient. Then this gown, you're going to go ahead and you'll tie in the back this way. Okay. And then the next thing we're going to do before we go in the room is we're going to go ahead and apply and find our mask. You're going to bend, there's a little bar in here, you'll just bend it for your nose. You'll place it over and swoop it over your ears. And I actually have mine on inside out, I just realized. Most of them do have an inside in and outside. You can tell by where the strings are, but you'll bend it over your nose and your ears. Okay. And then typically your isolation cart will have goggles, or if you wear glasses, your mask will have a face shield. So I'm going to pretend that I'm taking my goggles or my face shield and putting them on so that my eyes are protected. Glasses alone are not enough protection. The next thing that we're going to do is we're going to go ahead and we're going to put on gloves. With gloves, it's really important when we put these on that first we have everything done before we're going in the room, and then also that the gloves are going up over our sleeves of the gown. That way everything is protected, the patient's protected, and we are protected. At this point, this is when you're going to go into the room. You don't have to take anything in with you. All of the blood pressure cuffs, stethoscopes, everything that you'll need to take care of the patient, there will be separate ones in the room specifically for the isolation patients. At this point, I would go ahead and go in the room and I would introduce myself and finish my CG wiper, let the patient know that I'm Danielle, I'm a student with Marian University. I would identify the patient with their name and date of birth and verify that it is them with their hospital bracelet. And then I would raise my bed and explain what I'm doing today, take vitals or whatever the orders were for. When I'm all done with everything and I'm in the room, I'm going to go ahead and lower the bed back down, check if the patient needs anything else. I'm going to return the call light to the side of the bed, and then I am going to tell the patient when they can expect that we're going to be back again. And then at this point, once everything is completely put away and ready to go inside the room and the patient is returned, I'm going to ask them one more time if they need anything else before we leave. So my patient doesn't need anything else, so while I'm in the room, I'm going to go ahead and we are going to dispose of our PPE in the room. So first thing I'm going to do is I'm going to actually take off our gloves, and you're going to be really careful doing this. You want to make sure that you do not touch the outside of the gloves that have been exposed to the patient. So you're going to go ahead and remove those. And now that I have that removed, I'm going to stick my finger just under like that and fold them inside of themselves and place those in the trash. And then I'm going to remove my goggles, pretend that I did that. And then I'm going to go ahead and remove my gown. So when removing the gown, it's really important that you make sure that you touch the outside of the gown with your bare hands as little as possible. So once I have it untied, what I'm going to do is I'm actually just going to slip my hand inside the shoulder, and you're going to pull your hand out, and then you can kind of roll it inside itself. This one is disposable, but there will be a place for dirty linens there in the room as well. So you'll throw that away. And then the last thing I'm gonna do is I am going to very carefully remove my mask. And I wanna do this without touching my face or anything. Throw that away. Wash my hands with soap and water. And then I'm gonna go ahead and leave the room. When I exit the room, I'm gonna go ahead and wash my hands again, or use foam if it's a MRSA patient. And then I would go ahead and document everything outside the room.